Hello and welcome to another podcast from Odell Technology. Today we're fortunate enough to be joined by Andrew Raynes, Chief Information Officer at Royal Papworth Hospital, NHS Foundation Trust. Hello, Andrew.
Hi there. Hi, Stephen. How are you doing?
I'm very well, sir. Nice to see you again.
Nice to see you.
Thank you for joining us. And I guess the best way to start this whole thing is to tell us tell me about your professional background and how you ended up where you are today, please.
Sure. Okay, Steve. Well, first of all, thanks for having me on the on your podcast. So I joined Royal Papworth in 2017, following a long career I've had in healthcare IT. I was formerly the program director for IT at Barking, Havering, and Redbridge University Hospital Trust, and had the experience of working extensively in health, the private sector, including overseas. So I started with some very humble beginnings, actually, starting my career as a hospital porter. But at the age of 40, I decided I needed to self-fund my master's degree, which was really exciting. But I moved into informatics to implement my first Unix green screen technology in the early 90s. So that was quite exciting. But yeah, I've had many exciting opportunities, Stephen, including a number of high-profile projects, which has involved implementing IT in a GP-led practice within HMP Thameside, which is on the Belmarsh cluster of prison estates, which is obviously probably well known. Liquid Logic was an important project in a local authority in Leicester. And before working my way to Royal Papworth after Barking Havering, and most recently, probably one of the big projects I've been working on there is the rollout of a shared care record. So it really is an exciting privilege. So I'm a board level CIO, so I'm sitting with colleagues around the exec team, and that's really exciting and a real honour. Yeah, I'm a graduate of the Oxford SED Executive Leadership Programme. My master's degree is in healthcare informatics in education, and I'm a Chime certificated healthcare CIO and a leading practitioner of the Federation of Informatics Professionals. So last year I was really privileged and honoured to be nominated as one of the CIO UK 100, and I think that has to be a career highlight.
Oh, absolutely. I think it's quite an achievement in the UK currently. Tell me, Andrew, you haven't described them yet, but there's been a lot of achievements while you've been at Papworth. And I think one of the big things that I've seen is integration. Wondering if you could describe some of the work you've done there.
Well, I think, Steve, that's a really important aspect, isn't it, of what we're doing more and more in the technology space in health and care, which is, really making good use of the technology we've had and looking and using standards to integrate solutions. And we create these big assets, don't we, by implementing electronic records. And I think the fantastic thing is now with standards like HL7 and FHIR, SNOMED CT for clinical coding, GS1 standards in barcoding, is we've got these integration standards. And you're right, we were the first hospital in the UK to create a bi-directional interface using standards with Epic. And I think we were the first organisation outside the US. In fact, I think it was New York Presbyterian that did a similar thing. But yeah, it was a really exciting opportunity. And thanks to a digital exemplar program that we've been part of, have been able to build on that work and build up some of the technology estate, which got us from literally HIMSS 0 to HIMSS, kicking on the door of HIMSS 6 within less than 18 months. And I think, pound per HIMSS point, we've been one of the most cost efficient organisations in the country at levelling up that level of digitisation across the patch.
Tell me, how are you involved with the new integrated care system that's happening in your region? Have you got a lot to do with that?
Yeah, so I've been quite active in the ICS, as I was the former chair of the Cambridgeshire and Peterborough Digital Enabling Group. And I think that's a tremendously exciting opportunity to be involved and understand the the digital landscape and the changing aspects of that. So the big project there I mentioned was the shared care record. And I think we've had a distributed leadership model in Cambridgeshire and Peterborough. So as the chair, I was also obviously the exec lead at Royal Papworth, but it meant that I was able to come to the table with a feeling of what's happening on the ground. And I think sometimes that enables you to speak truth to power. And the shared care record for me was a really important ambition. For 20 years, I think, in my career, we've been trying to get to this place where we have almost a single virtual version of the truth in terms of patient records. And thanks to those kind of capabilities that I described in terms of interoperability and the shared care record, we've managed to start connecting services. So we're live with things like GP Connect. We've got one of our big acute hospitals now that's able to see primary, community and mental health data. And that's just the beginning. So we've got a fantastic journey ahead. And I think the second phase will be trying to share acute data across our system. So this will mean that we can expose any data we put into it, and you'll be able to see it in context of your own EPR.
Okay. And tell me, in terms of theatre connectivity, I know you've been working with Cambridge Medical Robotics and a number of interesting companies down there, because you've got some of the best surgeons in the country.
We have, Stephen, that, you know, it fills me with pride to think of that and to hear some of the outcomes. So, you know, in some of our practices and in cardiology, I just so humbled to hear some of our cardiology practices. Our patients' outcomes are potentially as much as 5 years longer life expectancy than other centres with like-for-like procedures. And that's truly amazing. Yes, and recently to come on to our new thoracic surgical robot, we're the first centre in the UK to have adopted that practice. And the staff have really welcomed that robot as augmenting the team, as opposed to you kind of an imposition, right? And thinking, oh my gosh, we've got a surgical robot. In fact, it's been really well embraced. And what an innovation that is, and technologically, what an advancement for the trust. And yes, another UK first. So it is, you know, by the grace of God go I, thanks to the teams, the support around us that enable us to do these things. But I think it's a fantastic opportunity.
I'm a big fan of the Digital Star Awards you've been giving every month to the cast of thousands in your operation. I think you've got, I think that's actually something that a lot of people should take note of. You're actually a very supportive human being, although you're quite modest. Can you tell me something about the Digital Star Award you're giving?
So, thanks, Stephen. I think the achievements of organisations are teams that work within teams, and I think it's tremendous that we have such a high-profile level of medical, nursing, clinical staff. And underpinning that, of course, I think is increasingly your digital assets. And I feel that my team are very much part of that, and the organisation makes us feel very much part of that. So we've tried to really focus on how do we develop an integrated improvement plan as a department that helps us feel part of that journey. So we've developed an action plan that responds to things like our staff survey, for example, and recognise and rewards based on meritocracy those individuals in the department that are nominated by their peers who have done exceptionally well. And I think they deserve reward. So we've developed this kind of digital star of the month, it's called, and that can be somebody working on the service desk. It might be somebody working in the information governance team, somebody in cybersecurity infrastructure in the projects team. And it's a start for them to shine. And we aggregate that through the year. And what that does is result in, at Christmas time, us having a bit of a celebration around how do we celebrate those that have achieved all of those merits over the year, and they get what we call an overall CIO award. And what that does is means that we reinvest in those individuals through not only perhaps a high street voucher, but a certificate, but also we invest in their personal development. So if there's something on their appraisal or something completely new but it's associated to advancing the tech in the hospital that improves outcomes for our patients, we will pay for them to do that course. And it's generated some real interest from the team. I think there's a little bit of competition brewing there, which is really good. And I think it helps improve staff morale.
Excellent. Tell me, with regards to some of the challenges of the waiting list that you've seen unfold in various trusts, can you describe what your department has done to help that?
Yeah, so we do have there's challenges throughout the NHS with that, isn't there? And I think we're really keen wherever we can to kind of streamline services and make them lean. So we provide a service whereby patients that can be seen where possible online through online consultancy. Obviously, being cardiothoracic centre, core business is to come to the hospital. But as they come into the hospital, they're greeted with things like kiosks where they can check in. So the self-check-in service, but there's also people. And, you know, I think we talk about digital transformation and we don't talk about the people that are involved. And yet, I think actually they come hand in hand. In fact, I'd say it's actually about people, isn't it? So we do need to be able to steer people, but just try to create flow. And we can do that through a number of ways. And one of them is obviously that way. We've introduced patient letters online recently, which means we've reduced, I think, something like 61% of our paper trail. But of course, recognizing, you know, in some aspects, the needs of patients might be to still receive letters, and that's absolutely right and proper. And wherever we can, though, we're trying to address the balance of digital poverty, but also those that want to be able to see staff or receive services online to be able to do that as well. So it's trying to provide the balance in that respect. The other one, which again is a technology that's really close to my heart, talks to standards again. And I think that's the kind of, when patients are seen that we're able to utilize things like barcodes to create efficiency in the hospital, identifying, for example, the patient or the person, the product and the place. And that's through a series of events of innovations whereby, for example, medications, that patients can be scanned by their wristband, the drug is scanned by the wristband, so we can associate the right patient to the right drug, or the right drug to the right patient rather. We can do that through things like remote monitoring. So we have a tool called Physicon, which is an implantable cardiac device. And again, that's something that uses a barcode that we implant in somebody, and it enables us to monitor them remotely. They don't need to come into the hospital, but through things like the barcode technology, we know which device is allocated to which patient. Any issues with that device, we know we've got full traceability through that barcode. Through the pandemic, Stephen, we went from monitoring 1,000 patients to nearly 6,000 patients now, which we're doing remotely through that kind of technology. And it's just fantastic. Blood is another example. What a precious commodity blood is. We sometimes take it for granted, but we're keen we maximize the, we make sure we regard that as a real precious thing. We don't want to lose blood. And through GS1 standards, we've been able to reduce the loss of blood from within 5% to down within 1% of blood loss. So we're making real maximising that use.
That's interesting. How does that work?
So we use what we call cross-matching. So essentially, we've got like almost a blood vend, and the blood vending machine almost is utilising, again, barcodes, so we can detect when there's blood replenishment that's needed, where blood is being allocated to a patient, or by the traceability. So that really helps us ensure that we maximise its use and reduce any waste.
So you can see where technology has made such a significant difference in the operation.
Absolutely, yeah.
Which has been able to do. I wasn't aware of the PhysiQuip. And that was 1,000 people to 6,000 people.
Just under, yeah. I think it's growing all the time, but I think that there still becomes a cap in terms of what you can manage as an organisation, even remotely. But it's fantastic that we're getting those signals back from patients that enable us to monitor that, and it's a really great innovation that we've got.
Very exciting. I hadn't heard of that.
Physicon, it's a implantable device, so it's probably classed as a medical device. So it is kite marked, and once we've implanted it, obviously it's traceable for a patient completely remotely from our organisation, and it really helps us in terms of the capabilities of our staff that we have to make sure that we keep an eye on them when they're not in the hospital. So it's sounds very simple, but I think those innovations that are best often are. We're increasing all the time the capacity for how we use that in just monitoring remotely arrhythmias and any kind of cardiac monitoring that may be able to detect ways in which we work that can improve a patient's experience out of the hospital.
How long is the device implanted for?
It's carefully monitored, so it depends really on the capacity and capability of the patient as well. So we'll do checks, but essentially once they've come in and had it implanted, it can it essentially may last us the rest of the individual's life. But we obviously want to take check of that, because we do from time to time experience those devices which sometimes don't work, and I think that's the advantage again of having something that you can recall and have full traceability of through a barcode system. So when it's due for renewal, we can interact, remove it, and make sure it's replaced or they have a new one fitted.
So how are you measuring better outcomes with these sorts of things? Have you got an internal registry going, or have you got some way of measuring patient-reported outcomes?
Yeah, absolutely. So we've got a cardiac respiratory physiology department that is exploring these, and they are amongst many. The key one here is reach. I think is actually, if you can use like an implantable or a wearable device, and we can have that kind of reach on patients out of a centre like Papworth, that's got to be better, hasn't it, for patients to know that actually there's a centre. It's like almost a virtual ward, isn't it, of patients with about 6,000 patients in addition to those that are in the hospital that we're helping monitor. I think that's a superb outcome.
Absolutely. And has the barcoding of delivering of drugs, has that reduced medication errors?
Yeah, absolutely. I think we talk about continuous improvement, Stephen, and we have all the time ambitions to keep a real careful watch on how we medicate, the safety of medication, how efficient we're being. And I think, some of the times we talk about a lot of manual entry when it comes to data, staff using keyboards to do it. But if we've got a scanning device that we can use to scan a barcode, and it gives you precise data every time you capture that data, then I think you're starting to work in a new realm of safety. You've not got the error with input, and through the connectivity of our systems, of course, including that with through Addenbrooke's, through our bidirectional interface, every time you're transacting, you can guarantee the data quality that goes from one point to another. So I think federating that data when you talk about shared care records is going to be critical, because that informs how we plan our resources, how we care for our patients, research and development, where we place money in terms of important resources. So that information is really important, it's accurate. And I think, I've heard a number of times of discussions about artificial intelligence. Artificial intelligence, of course, is still dependent on high quality data. If artificial intelligence is acting on inadequate data that doesn't have any integrity about it, it'll make decisions based on that. So I think things like the capabilities for capturing data, which is in a standard format, such as the NHS number, a GS1 barcode, it's going to act on really high quality, high-end data that we can then federate through systems. And we should all be doing that. We should all aspire to that creation of excellence in that data, so we're providing the best possible time to every patient every time.
I agree. Yes, I can see that.
I think it was, it might have been 2018, Interpol, I think, did some research on this and attributed something like 1 million deaths a year to counterfeit drugs. So, that's a lot of counterfeit drugs entering the market, right? So I think it is increasingly important, and it protects our staff. But another way we're using that, Stephen, if I may, is through things like ward audits. So, for example, ward audits and identifying your inventory of what's on a ward, for example, in terms of equipment, we've barcoded that. So what we can tell is on a ward, what equipment is where and how quickly we can identify it and find it and account for it. So that makes best use of the public purse. It also makes best use of our staff's time. Staff are busy. We know in health and care there are workforce challenges. So why would we not invest in a system that doesn't maximise the potential of our staff? So all the time spent looking for equipment should be null and voided with this kind of technology. It uses an RFID infrastructure, and we've got scanners in the ceilings that create a breadcrumb trail of where this kit is. And then we've got these handheld scanners that enable, if you're in the vicinity, then quickly can pick those up. So we've got a ward audit down to, I think, within 2 minutes. It used to take something like half a day.
Wow, that is an enormous cost saving. And you've done the same with drugs. So if I'm the ward sister or I'm the matron on a ward, and I just say I run out of paracetamol. Have you got some, how does that work in your system?
Yeah, so I think if we've run out of drugs, we've got we've got systems which help that replenishment. So intelligent systems which can say, actually, we're running low on this. We use the e-prescribing and our software that can reorder and make sure that we've replenished it through our pharmacy. And again, through the use of barcodes, we can control stock, manage our allocation. So for all stock coming into the hospital, it uses barcode capabilities. So we use something called EDC Gold. That
Yes.
comes into the system. Once it's in the hospital, we use that barcode technology in every room. So literally every room has a postcode through a GS1 or what we call a GLN, a global location number. So we can see then that where things are in the hospital, we've got this kind of visibility. And I think that really helps in terms of being efficient with staff time, being efficient with your products, know when to not overstock, but auto replenish. And I think, for finance directors that are interested in that from Physicon to the blood management that I described, to enabling remote monitoring, to finding out what's on your ward, you can actually create from that, not only that level of interaction with your patient and safety and that environment of where you're being really efficient with your staff, right down to the financials of patient level costing if you need to. So what you can actually create is a really constructive, efficient environment, which is based on high quality standards for care.
I had no idea. Okay, that's interesting. So you think you're going to get to a point where you can cost a patient from the day of admission to the day of discharge?
Yep.
That's fabulous. What about, okay, so let's look at a complex procedure, a hip operation.
Yeah.
I'm sorry, in your case, a cardiothoracic procedure.
That's
Royal
right.
Hospital.
Yeah.
So you think you can do that?
So we're on a journey. I think it's worth saying that, and I think again it's a continuous improvement. But the aim is, if you think about every interaction, combining a scan of a product, a person, and in the place,
Yes.
in theory, we've got those keys of that data to enable us to enact that and to be able to get that data. We've got the product, so you described a hip or a heart. If that comes in a certain way and you can scan it and it tells you this is a hip or this is a heart, this is belonging to Papworth Hospital, you scan the member of staff, you scan the location, you scan, or you have a scan which creates the procedural code, and you can capture that. That gives you that data every time. And I think increasingly, retail have been doing this for years, as we know. There's an initiative within health called Scan for Safety. It uses this kind of approach to managing this way. And we're on that journey. And I think we've captured a lot of that, and we're hoping to continue to do so.
Oh, that's exciting. I wanted to say, you've obviously achieved a great deal in a short space of time at Papworth, and you've got a great team. How many people in your team? I don't think people have any idea of the scale of your operation.
So I think that's, again, coming back to the team, it's all about team, isn't it? I have less than 50 staff, Stephen, doing that operation, and we manage over 2,500 devices. But again, not only keeping the lights on, but the transformational activity. But I think that comes together with teams working within teams, people knowing people, building relationships with organisations, ensuring trust. Once you have those things, I think it really helps in greasing the wheels. But you need to keep that dialogue with the organisation to maintain it on its journey. We're lucky that we've got a lot of innovators at Papworth, and we think they want to be engaged and again, advanced in that case. And I think that does help in terms of that engagement process and taking people continuously on that journey. But it's even more helpful when they see that innovation themselves and they want to be on that journey. So I think that's a real almost a catalyst for continuous change.
And Andrew, I think if I've got a small or medium-sized enterprise, I'm an IT company, and I think I've got something that's innovative, is it okay for people to make contact with you if they think they can make a meaningful contribution to your efforts?
Yeah, absolutely. And I really welcome that. And we're lucky we have a digital strategy board that we welcome input for people to talk about challenges they have in the organisation. We use that as a forum to say these are our priorities in terms of things in the tech space, but we definitely come at it from a point of what is the organisational priorities, what are the problems we need to fix. And once we put that through the kind of machine that goes bing, everything kind of goes round, and it gives us a top 10 so that we know constantly where our focus is, and that can be challenged by the digital strategy board so that we constantly have this agility in terms of saying, is that our priority right now? But a different challenge with that is if you're continually changing that, you won't achieve anything. And if everything's important, nothing becomes important. So you do have to be focused and go and really work hard at the deadlines and achieving things, not flitting from one thing to another. You need to have that kind of focus in going after it, and you'll see results.
So, Andrew, finally, in a perfect world, and that the trust was flush with money, what would you like to see happen in your department?
Oh, wow. That's the next level.
List.
Isn't it? I think with the amount of money that we can have, I think we need to continually work to look at being solution focused. And I think that is all the money in the world. I think is people are a massive asset, and there are lots of technologies out there. But I think it's interesting. I know they won't mind me mentioning it, but Gartner talk about their tech hype curve, which is often, and I hear it myself, is that, sometimes people go after a pet project or something, they want to introduce something and it's the latest technology. And what it can often do is it require a huge amount of expenditure. It doesn't necessarily deliver the value that you think you can do. Tech needs to be affordable, it needs to be manageable, it needs to be, most importantly, implemented in the right way. And that's taking people with you. They're the most important things. So if I had the money, I'd use it to continuously look at how do we continue to create value. And that doesn't necessarily mean massive wholesale swapping out of technologies. It means how do we more efficiently work so that we give clinical staff the right information they need to do what they need to do in the most practical way, utilising the resources that we have, making full optimisation of those uses so that we can look at other things that we need. But we come at it from a problem perspective as opposed to a giant wish list or the latest red balloon that flashes by.
Well, I love that. I've enjoyed that. Andrew, thank you very much for your time today.
Welcome. I've enjoyed it. Thank you too.
It's been great to see you. Absolutely fabulous.